Hey everyone, Dr. Barbara Eaton and my buddy Dr. Tabor here with you today. Thanks so much for being patient. Sorry, we're a couple minutes late. We went to hit broadcast and it said waiting, waiting, waiting. So we had to jump off and restart, but we'll jump right in and go deep. So Dr. Tabor and I have known each other since 2010, started coaching together in 2011. And at that time, he, in his practice, in his new practice that he shares with his wife, Dr. Gina. Hey, Dr. Gina. And their three amazing children. Perhaps you followed them and they had quite a journey with their twins. And by God's grace, they're both well. And so at any rate, Dr. Tabor early on in his practice developed a spinal hygiene class and really transitioned the way he was presenting wellness and took it from a model that we all know quite well, and that's from dentistry. So I want Dr. Tabor to talk about it and to get right into it, because here's the deal. We've really missed the most important element of practice member education and long-time care. So Dr. Tabor, take it away.
Awesome. Well, first of all, thanks for having me. And,
absolutely.
I hope there's no echo on this, but when it comes to dentistry, the tip there, the strategy that we need to take from them is the fact that they took it to the most simple aspect of what they do, and they got the simplest thing out to the public, right? And so as chiropractors, we keep fighting this battle of subluxation, which I'm a subluxation-based chiropractor, 100%. We educated our patients on that. But you and I both know that it takes some time to understand that concept. I mean, some of us go through 4 years of chiropractic school and come out and don't understand that concept, right?
Yeah.
And what dentistry did was they took it down to just say, if you don't take care of your teeth, they're going to rot, right?
Simple.
It's so simple. And as chiropractors, you say that to a chiropractor, like, if you don't take care of your spine, it will degenerate. And then it's like, it takes a second and you're just like, wait, you're right. If you don't take care of anything, it will break down. In fact, this universe is called entropy. I mean, if you don't change the oil in your car, eventually it'll fall apart, right? If you don't take care of, you don't have to do anything to let your body degenerate and become overweight and break down and get sick. In fact, it's easy to do that. But in order to keep it in good shape, we have to continually put energy in it. And it's no difference with the spine. If we just would begin to teach our patients that you have to actually take care of your spine and for it to last, then I believe we could actually start breaking through some barriers that chiropractic has never been able to break through before. In fact, I don't think this is an option, actually. I think, as the world, I'll use the word evolve. I'll use it, loosely here. But as we evolve as a culture, the nature brings up new things. Like I truly believe that's why chiropractic grew back in the early 1900s, was out of necessity. When the Industrial Revolution started to change and people started becoming more sedentary and lifestyles began to slow down. And so spines they were able to get back in a better alignment through exercise or anything. So then chiropractic began to evolve. Well, now in today's day and age, degeneration is rampant. It's a silent epidemic. We talk about subluxation being a silent epidemic. Spinal degeneration is at worse levels of epidemic than ever before. Now, these are some stats I got. The oldest article or study that I'm going to quote right now goes back to 2004. So here are the stats. Now, let's say 96% of 80-year-olds have spinal degeneration, which maybe, to me, that's astronomical. But for some people, they think, well, if you haven't heard this, raise your hand. Arthritis is just caused by old age, right?
Yeah,
now, everybody says that, right?
Yeah.
So then we tell them, well, did you know 80% of 60-year-olds have spinal degeneration? And they're like, well, 60 is still kind of old, so yeah, I can get that. But now there are even more recent studies that show 37% of 20-year-olds have spinal degeneration in our culture, from being sedentary, from video games, from looking down on their phones all the time. And then, so 20-year-old is not old. But some of the most recent studies even go beyond that, and they would actually do MRIs on 10-year-olds. And although all these were asymptomatic, 9% of 10-year-olds in today's society have spinal degeneration. So it's getting crazy. In fact, can you imagine if it wasn't spinal degeneration? Because spinal degeneration is kind of hidden; it's inside our body. Imagine if it was a rash. that like 80% of 60-year-olds had a rash, or 37% of 20-year-olds had this crazy rash. Or, I mean, it would be such epidemic proportions that there would be public outcries, there would be public health movements, there would be quarantines. You know what I mean? But because nobody can see spinal degeneration, and also I believe it's a little bit of a conspiracy. I think because now they can get back surgery and medications at younger and younger ages, why would they step in with a public health outcry to prevent spinal degeneration when it's silent, nobody knows it's there, and then all of a sudden you got to pay $100,000 to get back surgery? So we could take a clue from dentistry, because back in the early 1900s, this exact situation existed. People, their teeth were just rotting. Nobody was taking care of their teeth. It was falling out of their head. Dentists, the only thing dentists did back then basically was pull teeth. And if you were a dentist that tried to do anything else, you were too busy, because people would, you got a toothache, you'd go to the dentist, they would just pull their teeth. Well, Dr. Alfred Phones, he's now known as the father of dental hygiene. He saw that people's teeth were just rotting, and he decided maybe we can do something to prevent this. And so he put an all-out movement to try to educate people that there are things you can do to take care of your teeth. And so that's when we really started implementing brushing and flossing and this concept of dental hygiene. And now Dr. Alfred Phones is known as the father of dental hygiene. And from that sprang up the dental hygiene associations and dental hygienists, and those types of things started happening. And now dentistry is the second largest healthcare system in the world.
So wait a minute. What year was that?
1900.
Okay.
Yep. So
go ahead, the second largest.
So here's the question. Why do dentists give toothbrushes and floss when you go see them? Now that seems like a common sense thing, because every time you go to a dentist, you're going to leave with a package. There's toothbrush in there, there's floss, there's all sorts. But does that dentist make any money at all educating you or giving you toothbrushes? No.
Yeah, long term.
Well, you're exactly right. You're exactly right. They do it because they know if you start brushing and flossing, they're creating this awareness of dental health in your family. And so you're going to teach your kids to brush and floss. You're going to start doing things that you're going to notice if you have something going on in your teeth, because you're actually taking care of them. But chiropractors, we started around 1900 also, but we never implemented this concept of spinal hygiene. We never taught people that there were things that you need to do on a daily basis that would help keep your spine healthy. And if you don't take care of your spine at all, then it's going to rot. It's going to degenerate. And here's what I go back to this concept of our culture evolving because of sitting for long periods in school and then college and then work and then video games and then telephones. We're getting to a point in our society that something has to happen. That if this level of epidemic spinal degeneration continues to grow, medicine will grab a hold of spinal hygiene, or physical therapy will grab a hold of spinal hygiene, or some other type of training, or yoga, and you're starting to see it. If you'll open your eyes and look at some of the articles out there, I read an article that was in Forbes that was talked about taking care of your spine, and it talked about yoga. It recommended that you go to yoga. It recommended that you get up out of your chair and walk around a little bit. And we're seeing these articles start to come up all over the place, because eventually the way we're going, somebody's going to have to grab this concept and grow with it. And I personally hope that it's chiropractors, because I really feel like this is why we're not seeing bigger portions of the population. And I realize that there's a lot of gurus out there saying, well, we're only seeing 4.2% of the population because we're not good communicators, or because we're not educating about subluxation, or because we're trying to get into the medical fields. And so there might be a lot of different reasons why we're only seeing 4.2% of the population. But I'm saying one of the biggest reasons is because of awareness. Grant Cardone talks about this, right? It's called obscurity. Like, nobody knows you're there, and then if you're screaming this message of subluxation, nobody knows that you're really there for them until they have this major problem or this issue. And you could almost interchange these words, subluxation, because it is a silent epidemic, we call it that, with spinal degeneration, which is also a silent epidemic, but it's something that can be measured in the medical system as well. It can be measured by MRI. In fact, that's what they did on the 10-year-olds. It was an MRI, and they noticed end plate changes, or decreasing in disc height, or bulging in the posterior areas of the disc in 9 out of 100 10-year-olds. So
That's crazy.
It's a problem that I really can't believe we haven't looked at yet in chiropractic. But I think it's also a solution to how we can get to that next level and raise our profession. I listen to people all the time in our chiropractic profession. I listen to speakers. I get to spend time thinking, I'm extremely blessed with some, big movers and shakers in the chiropractic world. And they're saying, like, if we don't do something now, potentially we can lose it.
Yes.
Right?
Yeah.
And if we become a solution for 96% of the world population, because we're educating about spinal hygiene and taking care of their spine, and then we say, and look, I'm here to tell you that stretching does not correct subluxation. I mean, I tell my patients this. I want you to do these stretches at home every day. I want you to lay on your spinal molding rolls. I want you to do these types of things. But if you have subluxation, the only one that can correct that is a board-certified chiropractor. It's no different in dentistry. They want you to brush your teeth every day. But if you have a cavity, you could brush the hell out of that cavity and it's not going anywhere, right?
That's right.
You got to go to the dentist to get that corrected. So we're not going to push ourselves even more in obscurity by teaching people to do things at home. I believe we're actually going to break out of that obscurity and become a higher level of awareness when we start teaching people to do exercises at home and things on a daily basis. So
that's a great point, Tabor, that I think keeps individuals from suggesting things like home exercises, is they think like, oh my goodness, then, they're not going to need me anymore.
Right.
And that all comes back to education and the relationship that we build with them. It's just like, if someone goes home and brushes their teeth, does that mean that they don't need their dentist? No, it's like you said, it's actually bringing up more awareness to be more aware of. Maybe this is a terrible example, but like my husband and I were talking the other day about, I don't know, he noticed some imperfection, which I have many of them. And he's like, did you know? And I'm like, let me tell you something. Every woman knows about every single one of her imperfections and then some, right? And then if you compare yourself to the women in the magazines or on TV, you know even more about it because you have a heightened awareness of it could be this, but I'm here, right? So as they do stretches or as they do at-home things, especially if we've shown them how to do them properly and given the education about what it's about, then every time they're doing it, who are they thinking of? Dr. Tabor, Dr. Tabor, Dr. Tabor, Dr. Tabor. So let's talk more about spinal degeneration and so let's go back to kids. There are a lot of people in my audience who adjust lots of kids.
Sure.
And I think that we talk a lot about wellness when it comes to kids and symptomatology, but I don't think that we do talk about spinal degeneration. I honestly, go ahead.
I was just going to say, we talk a lot about adjusting kids, but here's what dentistry did. And here's what I teach, chiropractors to do is two things. If we want to build awareness about spinal hygiene, we have to, number one, get out in our communities more, get into our events and educate there. But what dentistry did so well was they got into schools. And almost anybody who, baby boomers or even before that, you remember dentists getting into the schools. You remember them showing you how to floss. You remember that it would be like, it would almost be like a dentist day. I mean, every time every year I remember coming out of the school building and then there was like these trucks set up. There was people in big tooth costumes, and we all left with brushing our teeth. And that was because they had a huge campaign to reach kids. And they knew that if they could educate kids, that they would grow up with this, they didn't know that they would grow up and go to a dentist, but they knew that if they got in with something fun and educational when they were early and young, that they would grow up with this really good feeling about dentistry because they had a good experience with it. And golly, dentistry had to fight an uphill fight because going to the dentist sucks.
That's true.
It's like the worst thing in the world. And
that's so true.
I mean, you have like this big tooth costume and you hand out toothbrushes and kids love dentistry until they go one time and then they realize that is not fun to go to the dentist.
Yeah,
right.
Absolutely.
Chiropractic is a ton easier and a ton better. So we should have a much easier time selling the enjoyment of chiropractic than dentistry did. But they did a great job because they came together. They came together and they created a movement that not only got out in the community and which we recommend, chiropractors get out to lunch and learns, go to events, set up booths at different fairs and home shows and health fairs, and share this message of spinal hygiene there. But I think it's even bigger than that. So we created a curriculum, we call it, so that it starts with a very easy, fun introduction to the spine and some stretching whenever we get into elementary schools, and then it grows into a more anatomical and educated type curriculum as we get to junior high students or we get to high school students, and they really get a ton out of it. And the way we actually get into those schools are twofold. Number one, how many teachers do you have in your office that are patients? And they love to have guest speakers come to their class, right? So they're already big fans of chiropractic, and then you say, well, can I please come just present to your class one day? It would be so much fun. We're going to talk about this, this, and this. And the teacher's like, absolutely, we'll let you do that, you know?
Especially this time of year when it's the end of the year and they're all kind of like bored.
Right, exactly. And then you can do that. You can approach principals as well. We talk about how you could actually approach the principal and get things set up for not only the teachers, but also the students. And I teach that portion, but I almost have to marry it with our lunch and learns and our events, because your lunch and learns, your events, that's financially driven. Like the new patients you get from those are going to fuel your practice. Those people become patients immediately. And the reward for getting into schools is just as valuable, but it's different. It's not as much financial, but it's a fulfillment. You know what I mean? Like when you leave an elementary school and all those kids are just loving your presentation and just checking out the spine, and you leave going, man, those kids are going to like chiropractic when they grow up. And that to me is worth more than just even the money or the new patients. But I think as far as our future goes, that's where it's at. If we could get more chiropractors touching our kids, and I don't mean just like with adjustments, I mean, you know, with education and with fun and with awareness that they actually need to do something every day to take care of their spine, then that's where we could really grow this concept of spinal hygiene.
Absolutely. And to teach our kids to take a stand for themselves and to, you know, whether it's posture or movement or no, mom and dad, I want to go see my chiropractor. Right. I think that's so important. So when they come into the office, it is fun. And, but with the fun, like you said, that they can understand. I remember, this young boy named John, his mom would bring him in, and every time he would come in, he'd have a new idea about chiropractic. And then he figured out, like, it was something that he created in his mind. And so I erased my dry eraser board. I'm like, can you draw it here for me, John? And I left it up there for several weeks, and he was so proud of himself. And that was worth like so much, because like, this is John's. And then whenever he was in the office and there were other people, I'd have them go in there, and then he would explain it was like an instrument for adjusting, or I can't honestly even remember what it was. It was exactly that. It was making an impression, just like you had said, and like my sister-in-law just said, and teaching kids to think outside the box regarding health. And I think as a mom of a 21-year-old and a 19-year-old, it's really fun to see that even though they bucked me when they were kids about eating healthy and, you know, well, they never really bucked me about getting adjusted, but now when they're making decisions on their own, they're eating healthy and they're taking good care of themselves, and they insist on exercise and they get adjusted on their own. And, you know, Samson's off at college and he sees his chiropractor. And I love that. So go ahead.
I was just going to say, one of the things that we do in the curriculum, especially for the junior high and high school, is we start off with that question of what is chiropractic? What do you guys think a chiropractor does? You know, and a lot of times they have no idea. Sometimes they'll say back pain, you know, if they even have heard of it before. And then so we ask them in the beginning, and then we go through our curriculum and we train and we talk about hygiene. We talk about how it compares to the teeth and all these types of things. And then we get to the end and we ask the same question. So what do you guys think that chiropractic is? And we'll go through and way more of them answer, and more of the answers are they help you take care of your spine, you know, and so just in one simple class, like a period of 20 minutes, you took a kid from growing up thinking chiropractic, not even knowing what chiropractic was, or thinking it's about back pain, to thinking a chiropractor helps people take care of their spine. So absolutely.
So all of you who are watching now and will watch again, Thanks, Dr. Michael, and you're welcome. Now you know why I love this guy, Dr. Tabor, and why he is one of the coaches at the 56-day chiropractic boot camp to double your business. It kicks off on April 17th. I'm going to pop up how you can apply for that. And Dr. Tabor and I are teaching a whole week on this spinal hygiene and how to transition from being back pain to, like what Dr. Tabor just said, and the curriculum and how to spread that message, because we really are at a tipping point. And Tabor, you said 4.2% of the population. Honestly, I hadn't heard that one, but
that was a Gallup poll, actually.
That is terrible. If you guys didn't hear that earlier in the broadcast, so as chiropractors, we see 4.2% of the population. Now, is that global or is that US?
I believe that was global, because it's a lot less global. So
yeah, which is just, it's awful, especially like Dr. Tabor said, if you look at when chiropractic came on the scene and when dentistry came on the scene, we ran at the same paces. And there's tons of social pressure about if you don't see a dentist, and certainly if you don't brush your teeth. And so it's the time is now. It's never been a better time to be a chiropractor, but we really have to grab hold of like the simplest things, just like Dr. Tabor said, the simplest things. Just start with the simple and run from there and take an individual from this point to this point. So Dr. Tabor, can you give just like a real brief overview of what you will be covering in the 56-day chiropractic boot camp to double your business?
Sure, absolutely. And let me start off with telling you why it's so important to learn this concept of spinal hygiene and teach from this concept outwards.
Yes.
Because as I consider myself a corrective care chiropractic. So we do x-rays, we do corrective care, and we do prescribe corrective exercises. And to your point earlier that you made was that, people think that they could just do their exercises at home and they don't have to come in for the adjustment. Well, one of the reasons is because we're teaching them that's the corrective exercise to fix your problem, right? Nice. Whereas we come from a spinal hygiene place was like, look, you need to do this every day on a daily basis for the rest of your life, just like you brush your teeth. And so they're not all corrective. So we have prescription exercises that are corrective, but we have some that are hygienic. There's the word. Yeah. Yes, they're hygienic, meaning what we're going to be learning and teaching on we don't want corrective exercises in spinal hygiene. We actually want to give our patients hygienic or exercises that are going to be general and that are going to help everyone, no matter who it is, if they do these types of exercises. So let me explain. In spinal hygiene, we have 3 core concepts. And these are 3 core concepts that virtually no one can argue with. No chiropractor across the entire country or world could say that these aren't true. Number 1, that the spine should be in a certain alignment. We know this is a fact. You can look at any study out there currently, or you can go all the way back to the times of Leonardo da Vinci. He was the first one to draw the spine straight from the front and has lateral curves from the sides, and that has been those types of observations have been noted since then. So the spine should be straight from the front. It should have natural curves from the side. The only time you could argue with that is you could say that there's a specific range of alignment that it could go in. But that's normal. So in spinal hygiene, we note that this spinal alignment is normal. So we're going to give specific types of exercises for someone to do that would benefit spinal alignment. Okay. Now, number 2, the second core concept is spinal range of motion. And again, there are thousands and thousands of studies out there that show the spine should move through a full range of motion, and it should be balanced. It should move through each range of motion in a balanced fashion. There are 3 planes of motion in the spine: forward, back, lateral, and rotation. And so we're going to give some specific spinal hygiene exercises that help people to maintain this range of motion. If they've lost it in any area, same as spinal alignment, if they've lost it in any area, then by definition, vertebral subluxation, you need to go to a board-certified chiropractor to get that corrected, right? But you still need to do these spinal hygiene exercises at home to maintain these even once they're corrected as fully as possible. And then the third area of spinal hygiene that we're going to cover is another common sense concept, which is the muscles around your spine should be strong and healthy. Mm-hmm. And we forget that a lot of times. And so in our society, we have people number 1, their spinal alignment is wrecked. number two, the range of motion, they haven't taken their spine through a range of motion in years, especially, I mean, it's just true. Like there's some people, you ask them to do these stretches and they're like, I didn't know I couldn't even move that direction. And it's like, because you've never even tried, right?
Awareness. Mm-hmm.
Yeah, awareness. And then number three is people, they're losing postural strength. And so we give global healthy exercises that keep muscles balanced and strong, the spine moving through that range of motion, and help or improve that spinal alignment, which we do spinal molding exercises, those types of things. And in this week of spinal hygiene training, those are the concepts we'll cover, as well as how to teach that to your patients, as well as some of the most effective and efficient ways that we've learned to do that over the last decade that we've been doing this in my offices here.
Awesome. Yeah, I'm super excited to share that with all of you because, I mean, Tabor and I are 100% committed to do everything we can for that tipping point. So to make sure that chiropractors have the tools that you need in order to go from obscurity to domination.
Amen.
So, I mean, we just can't keep sitting on the sidelines and taking not the scraps, because honestly, I don't even, the medical profession isn't our competition.
Yeah.
Really, our competition is indifference and obscurity. So the only way to change that is to completely dominate your market. Like, dominate first your practice, then dominate your community, and then you just keep expanding. So I know we're running out of time here, so I do just want to tell you all that Dr. Tabor and I, for those who are watching, want to offer you a tremendous discount on the 56-day chiropractic boot camp. So if you message Dr. Tabor and or myself, depending on where you're watching this from, we're happy to extend that discount to you. It does have an expiration date, so you'll want to be watching that. And the boot camp kicks off this coming Monday, April 17th. So Dr. Tabor, thank you so much. Any last minute words or comments to our fellow chiropractors? And I know there are also practice members who are watching, because I've been watching the feed here, as words of encouragement.
Well, I just want to say thank you for allowing me to be part of this boot camp, to share this message, because I feel very strongly that this is a concept, if we as chiropractors don't grasp right now and begin to own that, I'm afraid medicine will own it. I'm afraid physical therapy will own it. And then we will lose everything that's not back pain, right? Even if we own subluxation, we still need to own, I believe, the entire globe of spinal health and prevention. And that's exactly what this is. So this message is important to me, and I just appreciate the avenue to be able to share that with more people. So thank you.
Absolutely. And thanks so much. I have all kinds of notes. And for those of you who've been watching my Facebook lives, you know that I'll post like, this is what we talked about at this time, and make sure you check in at this time. So I'll be doing that when we get off today. Tabor, love you and Gina so much. Thank you for your dedication and your hard work. And I'm super stoked for the boot camp and just how many lives are going to be transformed. So God bless you all. Happy Easter to you this coming week. Right. Remember, the reason we have Easter is Jesus's resurrection, and we'll be celebrating it with our families. And we hope that you have a great weekend doing the same. All right. Thank you.
Thanks, guys.